Hello and welcome back to Visions for Health. I'm Wendie Trubow, one of the founders of Visions Healthcare, and my guest today is Dr. Richard Chen. He's board certified in family medicine and certified in functional medicine. Welcome back.
Thank you. Thank you for having me here.
So we're going to talk about fatigue today. Tell me what patients say to you, or what your spiel is when you talk about fatigue.
I think, when patients come in for fatigue, I try to find out why they're fatigued. I think I try to find out more about who they are, what they're doing in life. A lot of people have a stressful life, juggling work, home life, and everything that. I try to get that kind of piece of history there, but I try to find out what else is going on. Their sleep habits, what they do, whether they exercise, what they eat, and everything. And I try to get a better idea of who they are as a person. And then from there, I sort of try to get figure out medically what could be the cause of their fatigue.
So you alluded to stress. Can stress cause fatigue?
Totally. I think a lot of people, stress has a cumulative effect on the body. So that over years, if maybe somebody was did a lot of competitive sports as a youngster, and they sort of now they switch over to working life and start becoming deprived. That all sort of accumulates, and that causes issues, which sort of people see me there in the 40s and 50s, and it's like, oh, I'm doing pretty good now, but what the last 20 years? Mm-hmm. And so that could be a cause for fatigue, definitely.
And sleep?
Yeah, I think a lot of people I see are a lot of sleep deprivation, and that just affects, a lot of people sort of they take, some sort of caffeine to sort of make them feel better. But the main issue is that they should be sleeping more, and I find out how they sleep on weekends, and it's like, oh, so you sleep 6 hours on weekdays, and on weekends you sleep a little bit more, maybe 7 hours, 8 hours, and you feel better. It's like, oh, that's interesting. It probably means you need a little bit more sleep than you're getting right now, probably. So,
is there some number of hours that people need for sleep, or is it person dependent?
I think it's person dependent. I think there's some recent guidelines talking about how age, as we age, we may need less hours or so, but still everybody's individual. But I would sort of say, usually I would say, you sleep until you feel rested in general. I'm sure there's exceptions, but definitely, I would say good numbers, about 7 to 8 hours for adults or something like that. So yeah.
Can the food you eat alter your fatigue or cause fatigue?
Definitely. I think we have a lot of people who have issues in terms of they're stressed out, and when they're stressed out, their body doesn't really do well with sugars actually. So when people eat carbohydrate-rich foods, pastas or rice or stuff like that, they always have like a half hour, an hour later, they have sort of feel a little bit low, and they feel like sleeping. So definitely. That's always a good question to ask in terms of how do you feel after certain foods? Because that may be a factor for them in terms of how they deal with sugars.
I call that the food coma.
Yeah, I try to avoid that if I can.
Having it?
Having the food coma, yes.
Yeah. So what other things can cause fatigue for people?
So I think besides stress issues there, things I think about fatigue-wise is thyroid. I think I see a lot of thyroid patients. People with thyroid issues have issues where they have maybe they're not concentrating so well, they're gaining a little bit more weight than they want to, get a lot of recurrent headaches, all these different issues there, and it's quite rewarding if you diagnose somebody with thyroid. And I think a lot of times at Visions we order more of the full thyroid panel. Mm-hmm. A lot of times they just order one blood test and sort of try to depend everything on one blood test. But it's the body is not that smart that everything will be dependent on one blood test. So you get more of a test, you get a better idea what's going on. And I think it's quite amazing how people feel when they get diagnosed with thyroid issues and get put on the appropriate thyroid medication.
Do you feel like thyroid issues are more common than we think?
Totally. I think excuse me. I would sort of say that since most of our medicine depends on one blood test for the thyroid, it gets underdiagnosed quite often, and so I think we see a lot more when we do the right tests to check that out. So.
What else can cause fatigue?
Besides that, I think the mineral issues can cause fatigue, which is kind of interesting. There's, I think, of one specific imbalance. There's like a zinc and copper imbalance can cause energy issues, and it's kind of a interesting one because it happens more in females because it's one of the female hormones affects one of the minerals more, the copper. But it's kind of an interesting thing because it's sort of like if you have that kind of issue, you have the issue where your mind is racing, but your body is dead tired. So it's a bad combination it's like I've seen a couple cases of those, and it's interesting when you sort of get them better, sort of like, you know, by dietary wise, by supplement wise, you can make things better with that. So. And
when you say an imbalance in zinc and copper, is one of them typically higher?
So usually, you know, it's usually the zinc is usually low, and the copper is usually high. So a lot of people who have this issue there, zinc is found mostly in meats and eggs. So people who are like vegetarians, which is in general healthy, but some people can't really do well with a strict vegetarian diet, and so I see a lot of those patients there have that kind of issue there. So again, in general, vegetarians having more vegetables is good, but for certain people that can go off for certain people.
Do you know if there's any genetic reason why some people do better with a vegetarian diet than others, or is it just how you absorb? Or?
Yeah, I'm not quite sure about that there and stuff. I'm sure there are some genetic factors, but I haven't really looked into that too much there. So
you just sort of beautifully illustrated what happens when you fix one problem. Sometimes you can cause another.
Yeah, yeah. I think it's like, I think the goal is try to fix something without creating another problem.
Yeah.
Yeah.
So how do you work up the patient when they come in? And I mean, it seems like 85 to 100% of people are fatigued. It's pretty rare when someone says, no, I'm not fatigued.
Yeah.
So it sounds like what you've said so far is the sleep, the stress, the thyroid, the nutrients, the foods, the lifestyle. That's a lot of different things to evaluate.
Sure.
So what happens when the person walks in?
Well, I mean, I think so. I mean, a lot of, like most of medicine, it's all the history. I mean, I talk to them, figure out who they are as a person, and then I get a general idea of what things could be causing that there. Then I do the physical exam, and the physical exam will sort of confirm or disconfirm what things I'm thinking there. Then we sort of do the lab tests too, sort of as a confirmation too. And I think putting the whole picture together gives me an idea of what's going on. So it's interesting sometimes when you get after talking to them, you have a general idea. If the idea of what you think is going on fits with the physical exam and fits with the lab, it's like, okay, well, that was pretty cool. I mean, everything fit pretty well, and so, but that's the goal. But I mean, in general, everything can sort of you get a whole idea of what's going on with the patient there. So.
How often do you feel like you can get what's going on without labs, or is it really the labs are necessary?
You know, I think, you know, if I didn't have labs, I could make an educated guess. But I think it's like for most people, including myself, it'd be nice to get the numbers there. I mean, if the labs are confirm what I'm thinking, then I feel better. But if the labs don't confirm what I'm thinking, and I'm still really sure that the patient has what I think they have, then I would still go based on the clinical picture. But I mean, the labs still give you know, sometimes you get thrown a loop, and you say, oh, I didn't expect that at all. So in general, it's good to have information there.
So you mentioned zinc and copper and thyroid.
Right.
And you mentioned, I believe, mitochondria.
No, I haven't.
You haven't mentioned that. We talked about that before the show.
Yeah.
So how do you work those things up? What else are you checking when you're checking for fatigue?
So we mentioned the mitochondria there, and so mitochondria is sort of like how our body makes energy in general. So that's like the very basic unit of energy. And if people don't have that, then they're not going to have any energy at all. And so. And actually, it's kind of interesting. A lot of people who have mitochondrial issues have headaches too, like migraine headaches. So I remember of a patient who had headaches like since age 7. So, and like, you know, you can do testing for mitochondria, but I mean, you could also try them on a mitochondrial supplement. So I tried them on a mitochondrial supplement, and they had pretty good results. I mean, their headaches went better. They had more energy than they ever had. So it was kind of very, very interesting. Yeah. It's
pretty life-changing when you say someone's had headaches since they were 7.
Yeah.
And then they took a supplement and their headaches went away?
Yeah, well, I think, you know, that's what functional medicine is about. It's like, you know, looking at the cause. I mean, it's not trying to find the right medication for what's going on. It's like, well, what is the right what's the right thing going on in the body, what things is going wrong in the body, and sort of based on that, figure things out. And then if I get it right, you know, you can get multiple things right, because if I get somebody who has low energy and you help them get more energy, that's going to be major for them.
Yeah.
So
when you're looking at, when you got to the mitochondrial issue with this patient, how far into it did you get before you got to mitochondria? Meaning, what was the workup you did?
I think I did the regular stuff there. I mean, the patient had multiple other endocrine issues, had thyroid issues, adrenal issues. So I did all that stuff there first, and then, you know, sort of like, and those were like, had some results there, but then, you know, at some point she had problems with a lot of headaches, and so then I sort of said, well, you know, I knew that migraine headaches are usually associated with mitochondria, so I said, well, let's just give you the supplement, see how it does. And helped her. I said, oh, that's pretty cool. And then I sort of stepped it up more and gave her even more mitochondrial supplement, and she even felt better. So I think that was kind of a instance where I didn't need a lab, because, you know, the labs can be helpful, but I mean, for that one, it's like, you know, if I try a supplement and the patient does better, then that tells me that that's an issue for them. So. And
is that supplement something someone could harm themselves on?
In general, not. No. It's like, you know, it gives people I've tried mitochondrial supplements for, they usually get improved in energy. If they have a issue there, they can improve in energy. I mean, if you get, sometimes when you can, well, it still has some side effects, because, you know, I mean, I've had people who put them on mitochondrial supplements, and then they have some other issues going on there, and they have some physical symptoms get worse. So I would say, yeah, you can try it, but if you have symptoms, I would not be continuing that. So.
Can you give another example of someone you've worked up for fatigue? So you've given one with mitochondria. Do you have any others where people can start to map on for themselves, like, oh my goodness, that could be mine?
I thought that one of the recent cases I thought was pretty interesting was, I think this patient has been depressed for like years, like decades. And so she saw me, and I saw her, and I reviewed the past labs she had done before, and I said, you know, one of her neurotransmitters was off. So I mean, there's, you know, our body works on neurotransmitters, affects our personalities, and this one was more affecting. This neurotransmitter is more involved in terms of concentration, motivation, and hers was quite low, and so and actually she was on mitochondrial supplement. It wasn't helping her, and I said, you know, let's give you a supplement to sort of help this neurotransmitter. Because, you know, I mean, it seems quite low, and I asked her some questions to sort of see whether that was an issue for her. It's the neurotransmitter is dopamine. It's related to that, but also it's also related to stress hormones. And so I put her on that, and she saw me later, and she was like, normally she's not a, normally she like sleeps like really like late in the morning, and then she said, I feel great. You know, she'd been on psychiatric medications for like decades, and it wasn't working anymore. And then with this one supplement, she did a lot better. And so I'm looking forward to seeing her, because then the psychiatrist is calling, what is she on? Why is she getting better? So it was kind of interesting. So
that's pretty life-changing.
Yeah. I mean, I think it's like, you know, for that patient, like she was new to functional medicine, and she's like, how come this is working? What's going on? So, but it's all about the looking at how the body works. I mean, she was on a medication which is trying to stop the breakdown of the medication, but her body wasn't making something. So it wasn't really working, but I gave her something which would help her body make something, make her the neurotransmitter, and then that worked better for her. So
let me just make sure I got this right. She was taking an antipsychotic med that prevented the breakdown of dopamine,
right?
Except she had a problem making dopamine in the first place,
right?
So if she's not making it, it doesn't really matter that she's not breaking it down, because it's just not there to stay in the synapse.
Right, that's correct.
And so you diagnosed her. Did you, using a urine test?
Yeah, it was a urine test.
And you said your dopamine is low.
Yeah,
why don't you take some dopamine?
Yeah.
And she no longer needed her antipsychotics, or they weren't working anyway?
Well, I mean, she's got. I wasn't prescribing that medication, so the psychiatrist gave me a call, and the psychiatrist I suggested to wean down the other medication.
Yeah.
Because she's the one that the psychiatrist prescribed it, and so.
So how much work on the gut do you do with fatigue? If you're talking about the neurotransmitters and the relationship with the gut, where does the GI function come in?
That's a good point. I mean, I think the gut is we sort of like miss it sometimes, but I think even people who don't have any gut issues, they may have something going on in their gut which is causing the fatigue. I mean, I think a A lot of people, I mean, they may have some sort of underlying infection going on in their gut-wise, or some sort of bacteria or yeast going on there, which they don't know about, and that can make quite a difference, because it's basically depleting their body, you know, having their body deal with a underlying infection which should not be there.
So the stress of dealing with an underlying infection in the gut, or an overgrowth,
yeah,
or
I mean,
an imbalance.
Totally. I mean, so many things going in the gut. I mean, I think it's like, you know, it's a good point that, you know, so much stuff, everything we have, it depends on the gut. I mean, we don't have a gut that works very well, then nothing else is going to work, because that's where we get our nutrition. That's where we get rid of our stuff that shouldn't be there. So that really should be one of the focuses and stuff like that.
Do you have any other examples of patients you've looked at who have fatigue? So you've given the mitochondrial example, you've given the example of the patient who had, I'm totally blanking, the adrenals,
the thyroid.
Yeah. What else comes up? I mean, what role does lifestyle play in?
I think that's. Thyroid? I mean, I think that goes more into the stress part there and stuff like that. I mean, if they're sort of, you know, on, like, you know, their life is, you know, they're like on, like, going like a mile a minute all the time and stuff like that, and that's going to affect them. I mean, they're like saying, well, I love my job. Like, well, it's great you love your job, but even then, your body needs to sort of recuperate. You know, you can't like love your job 12 hours a day and be okay with that. So it's sort of like, you know, it's. I think that's sort of like a wake-up call to people when they realize that, you know, even though you like your job, I mean, or even if you don't like it, especially if you don't like your job, you know, how much stress you have in a day will affect things and stuff like that. So,
can you say a little about how that occurs? You know, what happens in your body if you're stressed?
I think there's a really good book. It's called like Why Zebras Don't Get Ulcers.
It's one of my favorite books.
Yeah, but I think it's I think basically the short answer is stress affects every part of your body. I mean, nothing works right. You know, it's like, you know, if you have all these hormones going through our body, and with stress, every single one of those hormones, there's some resistance to it, so things don't work well as they should be. So I mean, you know, we talk about how stress affects our gut. You know, maybe things don't absorb as well. Maybe we get ulcers from stress. You know, every single part of our body gets affected. So I mean, for everybody, I would say that's their number one worry, because, you know, we don't have to worry about like we're being in a war or anything like that, but people have to worry about, you know, how much stress is their body there, and there's definitely a little bit of stress. We need a little bit of stress to sort of survive every day. You know, we need a little bit of challenge, but once that challenge is a little bit higher than we want to, that's going to affect things. And so our goal is to sort of like be aware of what's going on in our life and how we're dealing with it, because if it's going past certain amount, then we need to do something about that.
That actually seems like it would be the hardest thing for people to do. You know, it doesn't sound that hard to take a supplement or a med, or maybe even cut out a certain food. But now you're talking about altering how people live.
Yeah.
And what you also just said is that if you feel stressed, that impacts every cell in your body, and that can lead to fatigue. However, if that stress comes from your job and you need your job, you're in like a bind.
Yeah.
So what do you say? I mean, how many people actually take this coaching of, hey, you need to work less, or hey, you need to change your job, or? You know,
everybody's different, so not everybody can hear that message. There are some people are more, and they have to think about it more, and there's some that's like, oh, I never thought of that. But so I mean, everybody's on a different point in their journey toward making change. For the people that are ready to make changes, you know, it's cool when you see them back, you know, a month, 2 months later. It's like, oh yeah, you did this. Wow, that's really good. So that's kind of cool. But even if, I mean, I think a lot of people usually, excuse me, aren't ready to make changes and stuff like that, and you sort of go with where they are. I mean, there's usually some reason why they can't. Maybe they haven't thought about the reasons why they should or reasons why they shouldn't, and you sort of figure things out, and then you work with them. I mean, it's like, you know, get to the next stage where they can think, oh, maybe I should do this. Maybe I should make some changes. So,
can you talk about the relationship between stress and how the thyroid functions?
I would sort of say that, you know, when your body is stressed, you have it can create some other thyroid hormones, which actually put a brake on your thyroid hormones, actually. And so, a lot of people come in thinking they have fatigue from the thyroid, but if they're stressed out, their thyroid isn't going to be working well just because they're stressed out. So you don't have to blame, the thyroid will not be the main issue, it will sort of be a result of the stress. That's why the thyroid isn't working out.
So the thyroid takes the rap a lot when it might be something else?
Yeah.
Like the adrenals?
Yeah.
Okay.
And also, a lot of things too. When you have stressed out, your nutrition may go down a little bit there. It may affect the different minerals, your zinc, your iron, all those will affect your thyroid too. So you can a lot of different factors how stress can affect the thyroid besides just the stress itself. So.
Seems like a really big conversation with people.
Yeah, I think people are when they realize that how everything is connected, it's like, so nothing is off by itself. So, I can't, how I live one part of my life affects everything else. It's never as simple as like, oh, I can do this and it only affects my sleep and nothing else will be affected. Like, no, everything is affected. So.
I always think of Eva from WALL-E, that white robot whose arms come off and head comes off and body seems to come apart, and how we're totally not like her. That we can't disconnect in a way she can.
Yeah, that's probably, I guess that's a good thing probably.
Right.
We don't want to take apart body parts.
What do you say to people who work at night?
I think it's a tough one. I think there's a lot of stuff showing that our bodies we're meant to be daytime people. And so if they have that there, I would say at least try to be consistent schedule. A lot of times people sort of try to do work at night and then try to be switched on their days off, try to be back to normal life as everybody else's rhythm. But then it's kind of takes a toll on their body. And they're always switching back and forth between nighttime, daytime sleep, nighttime sleep, and their body's always in flux. It's like they're always in a jet lag mode all the time. And I would say, in general, you try to you have to do a sleep change that would be doable for you and doable for the rest of the people in your life, and maybe not too much of a change, so your body doesn't have to change that much, because our body doesn't do well with changes over and over again in terms of sleep cycles. It's like a living machine, and there are rhythms that are meant to be kept. So.
You just reminded me of people who it's worse to gain weight, lose weight than to just stay at one weight, whatever that weight is. It sounds the same, like I think you're highlighting the repeated stress on the system is what the problem is.
Yeah.
So what else should I ask you about around fatigue? Because tell me about alcohol, actually. We haven't talked about that.
What about alcohol? What aspect do you want to talk about?
Does it relate to fatigue?
I would sort of, in general, it sort of affects your liver, and so I would say, definitely, some alcohol. Especially like red wine has been helpful there in terms of it's healthy there. But I think when you get too much alcohol, it can affect people's livers, and that's creating stress for the body too. But I would also say that alcohol for people who have other issues going on gut-wise, perhaps they have some overgrowth there that doesn't do well with alcohols. That may not do well too. So I would sort of say, I would say just like anything else, it's okay in moderation, but I would sort of say too much can affect people, and so that would not be a good thing.
Does the type of alcohol matter? So wine versus gin versus something else? Because I know wine converts to sugar pretty quickly.
Yeah, I think they're all. I think that the big picture-wise, maybe there'll be some fine differences, but they're all alcohol.
They're all stress.
Yeah. Okay. So it's like it's I would sort of say there's I think red wine is a little bit healthier because of all the different nutrients there, resveratrol in there and stuff like that. But I would sort of say I wouldn't be looking at that, or to say more in terms of what it is itself. So.
What how do you work up an imbalance in the GI tract that might be leading to fatigue? If you're concerned about an overgrowth of some harmful bacteria, what are you doing for that?
Well, I think you go by the history, figure out what kind of things are going on there, what kind of symptoms, whether they have heartburn, they have a lot of gas or other issues going on there, And then we have different tests we can do based on that. We can do tests such as we could do tests that may be covered by insurance, like more like blood tests, checking things like evidence of past infections. That can be an indirect indicator of that. You can do you can do tests, so like breath tests to see whether somebody has bacterial overgrowth. You can do stool tests, which usually aren't covered by insurance, which would check what kind of bacteria is going on. Or you can also treat too, empirically too, depending on what's going on. And any one of those things can give us some sort of answer to what's going on. Okay. So.
All right. I asked you what I should ask you, then I asked you more questions without letting you answer that. Anything else that's pertinent for fatigue? And I guess the problem is, how would people even know they're fatigued? Because I would imagine fatigue doesn't develop A to Z overnight, it develops over time.
Yeah, I mean, I think most people come in because they realize they are fatigued. That's why they want to come in. But I could sort of see, some people don't realize they're fatigued until they get rid of the fatigue. It's like, wow, I didn't realize how tired I was. Actually, it just brings up a point to me. It's like, another mineral that can be involved with fatigue is magnesium. It's kind of interesting too. But anyway, I would sort of say, if they compare themselves to other people around them, it's like, so how come they can do this and that? How come they can sort of do the whole day, and how come after at 5 o'clock I have to come back and I have to rest because I can't do any more? I think you can look at who you are now compared to past times, or you can compare yourself to other people in terms of similar age and similar lifestyle, and see what's going on. I think that's probably the best way to figure out whether you're tired or not. So.
Do you think things like meditation and yoga and things that calm people down make a difference for fatigue?
It can be. I think it's more for people who are stressed out. I can definitely see that being a factor. That will sort of, it's sort of calming their nervous system, so they're not so revved up. And being revved up, it takes energy. So the less revved up they are, that can be quite helpful.
Did I forget to ask you anything?
I think you were pretty comprehensive. No, I think that was a good overview of a fatigue.
I mean, it sounds like the bottom line is it's treatable, and it has a number of different causes. Right. And it's worth not just suffering over.
Right. I think it's like what I guess the point I would sort of say is like, yeah, I mean, there's in most cases we can find out the cause of fatigue. And I think it can be pretty. I just reminded as we were talking. I'm getting reminded of little cases. It's like, we talk about the gut. People just like somebody comes in and they realize they don't really digest well and stuff like that. And I help them with their stomach acid, and it's like, I feel more energy. It's like it's kind of interesting. Like the different connection you have. Somebody improved their nutrition, improved how well they digest, and now they have better energy. And so it's totally not what you would expect, but I mean, it makes sense because everything is connected. So.
Well, so if they're digesting better, they're absorbing better. So then if it's a micronutrient deficiency or a nutrient deficiency, then they've just increased their nutrients.
Yeah, totally.
So that actually makes very clear sense.
Yeah. So it's good.
How long does it typically take patients to get better once you've identified the cause?
Well, if you identify the cause, I mean, you can get pretty good results within a month or two or something like that. I mean, if they have a micronutrient issue there, that'll take them 1 or 2 months or so. If it's more of a hormone issue, they can feel something pretty in a couple of weeks.
So you're saying that once you identified the cause, people can get better within weeks to 1 to 2 months?
Yeah, totally.
That's really quick.
Yeah.
After suffering with something doesn't matter how long you've suffered, if you get rid of it?
Well, I think if you find the right, and everybody doesn't have just one factor going on. There's usually maybe one major factor, but there's usually a lot of other factors going on too. But if you figure out what's the main issue going on for them, and you sort of do the right things to help that, support that, it can be pretty life-changing. Yeah.
This is extremely inspiring.
Yeah, I think it's great stuff, and I think that's why it's great doing this.
It's clear you love it.
Yeah, I mean, I think I see how it affects me, and so I'm happy to sort of like educate people, and people want to be educated about this.
I think it's extremely refreshing to see a doctor who does what they say to do for others.
That always makes more sense. Yeah.
we've come to the end of our time. And this has just been phenomenal, and I think hugely educational for people, because I also think that most people, until they recognize that they're fatigued, are just suffering. So even this conversation may open up things for people to see, oh my goodness, I actually am suffering. So thank you for being here.
Oh, thank you for having me here.
My guest today was Dr. Richard Chen, and you've just completed watching another episode of Visions for Health. Thanks for joining us.